I'll move the microphone. Thank you, Rod. First of all, I would also like to acknowledge the traditional owners of the land on which we're meeting, the Wurundjeri people of the Kulin Nation. I would also like to extend that to any Aboriginal and Torres Strait Islanders that may be in the room with us today. I would also like to acknowledge the excellent presentations that we've already had to date this morning. I think that it is a very encouraging and positive sign to see so much presentation around innovation and quality improvement already from the presentations that we've had today, and I look forward to seeing what more we've got to come this afternoon. I have been tasked with providing an update on the maternity and newborn clinical network. And through that, we will run through the projects that we've done up till now in 2018, and then the projects that are coming in 2019, with a little bit, I hope, of very exciting news at the end of the presentation. As part of this, I would definitely like to acknowledge the enormous contribution that comes from the team at within the Clinicians as Partners division at Safer Care Victoria with the Maternity and Newborn Clinical Network. I am going to make the project officers in the room today stand up, please. Tracy, Felicity. Anyone else? They're all standing up. Ali? All right, everyone's standing up. So under the very capable leadership of Felicity Loxton, this team have been absolutely instrumental in driving the projects that we're talking about today, and I would like to acknowledge their hard work formally here today, so thank you very much, team. So without further ado, let's just review the projects that we've gone through in 2018. A lot of this work is still ongoing, and a lot of you will have been involved to date with some of the work that has happened. Again, I thank you for your contribution, and we look forward to what more we can achieve. So the first project I'd like to talk about is the maternity dashboard. We've heard a lot today about how we are using data to drive quality improvement. The maternity dashboard really came as an innovation to talking about how do we make that data more easily accessible by hospitals to drive their quality improvement. So if we don't know where we're at, we don't know where we're going. We don't know how well we're improving. So this is an absolute key project. So we're very fortunate that the local dashboard has been established, and there's been enormous engagement across the entire state, including within the regional areas, about how do we assist health services in using the dashboard to look at their current performance. So there have been site visits performed by Michelle Knight, Wendy Kutchi and the regional midwives, which I'll talk about later, conducting site visits right across the region, right across the state within the last few months. We visited all sites that have access to the BOS local dashboard, acknowledging that Northern and Western meetings are still yet to come. One of the key themes that's come out of this is about the requirement for hospital executive support in helping services understand their data. So it's one thing to give you numbers, and we've heard, and I absolutely acknowledge Tanya's little spiel about data this morning. It is absolutely true. The easiest thing to do is deny the data. So there is a lot of support that needs to be given to health services, and particularly to the clinicians within those health services, about how do we interpret that data. And I would encourage all hospitals to seek that support within their own structures, but to also ask for help if you need it. Help is available. But really to understand your data, if you don't look at it, you're not going to know where you're at. So we would encourage all hospitals to actually have a look at it and encourage their executive to get involved to have a look at it as well. So data integrity has been identified as an area of improvement. I'm not going to dwell on that too far. We've talked about data integrity. Generally speaking, the maternity dashboard data is as good as what we're seeing in PSPI. It's a little bit more, well, obviously it's a lot more concurrent than what we've got happening with PSPI. So the idea is that you will have this data more accessible to you. There are ongoing evaluations about establishing the next steps for the local dashboard, and we'd encourage you all to provide feedback on that. The e-handbooks is another big project that's running through Safer Care Victoria. So the maternity e-handbook was born in early 2017. The aim is to provide clinical guidance for care. It is a subcommittee of the Maternity and Newborn Clinical Network with a multidisciplinary group of 22 members currently. Those members include obstetricians, midwives, consumers, representatives from PIPA, VMIA and the Victorian Aboriginal Health Services. And the members currently on that committee come from 16 different metro, regional and rural maternity services, so there is very broad representation in the development of the e-handbook guidelines. The group for the e-handbook meets every second month, with a lot of work being done in between those meetings, with great acknowledgement to the contributions of the members of that group. The initial topic development is undertaken by 3 or 4 authors with a particular interest or expertise in that particular area, and then further developments are done by the whole group. I would like to acknowledge most of the guidelines that we've had go up have been through at least 10 to 12 drafts. It is an enormous amount of work to get them up for the e-handbook, and we do acknowledge all the hard work that goes in. And we do ask for contribution from expert subject matter experts when needed. The process of evidence gathering and appraisal and draft development are under review. And we're really focusing at the moment on ensuring best practice transparency and alignment with the neonatal e-handbook work, but also providing a lot more transparency about the quality of the material that's going into the e-handbook, acknowledging where the references are coming from, because that has been some feedback from the sector. So the recently published topics, which have been extremely hot this year, have been the obesity during pregnancy, birth and postpartum guideline, which I think that I will broadly acknowledge the sector was hanging out for. I would also acknowledge the postpartum hemorrhage guideline, because again, that is enabling us to provide some degree of synergy between health services about how we're approaching PPH. And I think particularly those of us that are involved in regional areas, that has been very critically important and well received by the hospitals involved in regional morbidity and mortality, having a standardised approach to PPH management. So the first year evaluation of the maternity e-handbook acknowledged that most of the users of the e-handbook are midwives. Good on you, midwives. And most of the users' primary work is in a public inpatient service. Quite a large number, 38%, access the e-handbook often, and that means more than once a month, or very frequently, which is more than once a week. So once you're in, you seem to stay in and keep going back to it. 58% of the respondent services actively support the e-handbook use, which is encouraging, but only 11% don't. So that suggests we're not quite there, but we're getting pretty close to actually having something which is what you are wanting within the sector. There have been many positive comments about the e-handbook being useful, user-friendly, and reducing guideline development for services. So hopefully we're reducing some of the work that you're having to do within your individual health services. But there has been feedback, as I've already acknowledged, around the transparency of the data and the evidence that is provided to support the guideline, and we've acknowledged that, and there is a process going on about how do we include that without making the guideline unwieldy and messy for the consumers, you guys, to actually understand what's in there. So the ones that have been most popular are induction of labour, decreased fetal movements and pre-labour rupture of membranes at term. But I would anticipate that the two that I've just talked about, obesity and PPH, will also be very frequently accessed over the next few months, as those are very, very new onto the website. The neonatal e-handbook, of course, has existed much longer than the maternity e-handbook. There are nearly 100 topics published. They're in a, I think, probably reasonable to say a second phase now, looking at what's already published and validating that, looking at how the review process is occurring. It is an extremely popular and well-received e-handbook by the sector, and we do acknowledge, again, the hard work that goes into maintaining that. From January 2019, both the e-handbooks will be maintained by Safer Care Victoria and are available on bettersafercare.vic.gov.au. The current and new topics are going to be authored by clinical experts in their field and will be featured in 2019. I'll come up to what those ones are in the 2019 update. But really acknowledging that these e-handbooks are provided for you as the clinicians that work within the sector, so all feedback is of course welcome. Wrong way, let's go that way. So the Maternity and Newborn Services User Guide was developed as a guide in 2018 for Victorian maternity and newborn services to strengthen clinical governance and quality and safety processes. I do acknowledge that this was only released very, very late in 2018, and some of you may not have had the opportunity to look at it yet. I would encourage everyone in this room and beyond to have a look at the content of the Maternity Services User Guide. Please provide feedback. We hope that it will help services respond to the needs of women and their families and drive continuous improvement. The online guide will be updated regularly, so please make sure that you save the link rather than the actual document so that you can actually keep having a look at the up-to-date version, and try and circulate as much as possible within your individual units to make people aware of its existence. There is a contact email provided on the webpage for questions and feedback regarding the Maternity Services User Guide. We've already heard today, and I absolutely acknowledge Liz's presentation on fetal growth restriction. It was quite a powerful thing to hear about, but as a sector we are becoming increasingly aware of the significance of fetal growth restriction, both detection and management. We know that it is associated with an increased risk of stillbirth, and I'll talk about that a little bit more shortly, but also other adverse perinatal outcomes. For us, it's indicator 3, we've talked about it briefly already today, which is the proportion of severely growth-restricted babies born at or after 40 weeks that were undetected antenatally. So the Stillbirth Centre of Research Excellence and PSANS have developed an education program around fetal growth restriction that was rolled out by Safer Care Victoria last year for the Maternity and Newborn Network, around improving the detection and management of fetal growth restriction with an aim of reducing stillbirths or preventable stillbirths. So the fetal growth restriction pilot education program that was rolled out here in 2018 has targeted 510 clinicians so far within Victoria, which is fantastic. There are 130 train-the-trainers already for the program, of which these are 106 midwifery and 16 obstetric and 8 GP obstetricians as well. So the program's well and truly reaching into all aspects of our clinical work. In terms of, In terms of the evaluations so far on the program, 80% have returned their valuations, and of all of those that have responded, they report an overall increase in knowledge and confidence around best practice with the detection and management of fetal growth restriction from pre to post assessment, which is fantastic. 89 to 100% in total, so almost everyone said they were satisfied or very satisfied with the content and the delivery of the workshop. So we are very happy with how the program has rolled out so far. We acknowledge that we've got 7 further planned until 2019 in April, and I'm looking hard at Tracy right now. I do believe most of them are booked out, but I will carry on and give you a little bit more information about how you can access the fetal growth restriction content a little bit later on in this presentation. So the other campaign that came out towards the end of 2018 was around decreased fetal movements. It was an education program for clinicians, but also a public health campaign as well. And this is really, again, acknowledging that the raising awareness of fetal movements may well help prevent stillbirth. So we're really focusing on preventing stillbirth within the state. So Safer Care Victoria, again, partnered with the Stillbirth CRE, the Centre of Research Excellence, around an awareness campaign on stillbirth prevention, looking at educating and empowering parents around becoming aware of fetal movements and reporting any change in their fetal movements. It's also been a lot of work around making sure that clinicians understand the importance of fetal movement and that they're communicating that information to their pregnant women effectively. So what we're trying to do is support nationally consistent messaging and clinical practice, and there was a social media campaign that went out to support this. So all up, the social media campaign engaged with 85% of the target audience, which is fantastic. It actually got to where it needed to go. And there were over 2.4 million ad impressions, so that's fantastic in terms of us actually having a reach. It has been extremely well received by women with a very positive response. So in terms of engaging with the sector, we have tried to get some of this work out to you in a way that we hope will make it easier for you to understand the work that's going on to become involved. The first of those has been through webinars. The Maternity Dashboard webinar ran at the beginning of last year, or first half of last year, and that was really around that first project that we ran around the maternity dashboard for the local maternity dashboard. And that was a webinar that reviewed the overall dashboard and discussed how you can best use that to track your performance. I would encourage people to have a look on the Better Safer Care website because that presentation is still available. So when we talk about using data, that's a good place to start. The other webinar that we conducted last year was around decreased fetal movements, which was done in July and coincided with the beginning of the campaign to clinicians around decreased fetal movements. It was very well received by the sector, and there were 790 Vimeo plays, which is off the website, and 115 from the conferencing venue that we used after the event. This webinar is also still available for viewing for those that haven't seen it. The other webinar that was run largely in response to requests from the sector was around obesity and pregnancy, and this coincided with the release of the e-handbook guideline on obesity management in pregnancy. And this again was extremely well received and well attended, and again is still available on the website. The other component that came in 2018 around engaging with the sector was the employment of some regional midwives. So the state was divided up into 6 regions, and each of those regions had a midwife appointed. I would like to acknowledge that most of the regional midwives, I think maybe all, are in the room today. So thank you to all of the regional midwives that have been involved in this work. They've been working collaboratively with the maternity services to ensure that the maternity dashboard project, the decreased fetal movements campaign, and also the fetal growth restriction workshops have been rolled out within the regions, and I think that has helped substantially around the quality improvement across the sector, and I think that's been a fantastic initiative. So where do we go from here? So when we're talking about 2019 projects, there are a few things that are continuing, a few things that are changing, and some very exciting things that are coming. So the maternity dashboard is evolving. So we've talked about the local maternity dashboard that came in 2018. In 2019, we're hoping to move to a statewide maternity dashboard. At the moment, that's sitting in a working group which comprises of regional and metro midwives and obstetricians, data experts, Department of Health Policy and Performance are also in that group, looking at the indicators similar to the local dashboard with an increased ability to filter, so with a bit more sophistication of data synthesis sitting alongside it. In terms of where that goes, there's been a lot of discussion around escalation as to what do you do when you see it, and that's still a process that's very much being discussed, and will follow the same process that currently exists with Safer Care Victoria, the Department and Health Services. So the build of the dashboard is happening at the moment using a very fancy statistical program, which I won't try and explain to you at the moment, and there is a pilot that will be launched in April 2019, and we would be looking for pilot sites that would be interested in becoming involved in that project. And the release of the dashboard across the state will go ahead as soon as it's deemed stable, probably about 3 months after the pilot. The next project that's underway at the moment and continuing through 2019 is around the development of a home birth guideline. So a working group's been established with representation from public and private home birth services, midwives, obstetricians, Ambulance Victoria, Piper, the Department and Workforce branches, RANSCOG, and the Australian College of Midwives. This group's being chaired by Tanya Farrell and is supported by the research expertise of Dr. Miranda Davis-Tuck and the governance experience of Professor Caroline Homer. So the working group's current focus is looking at robust evidence-based inclusion criteria for home birth in Victoria. But another important element of the work will be discussing and setting out pathways for communication, referral and transfer between services for home birth. So really providing some more support to the sector around home birth services within Victoria. The anticipated publication date is December of this year. The other guideline that's under development now and has just had a project officer appointed to govern this work is around the extreme prematurity and care at the cusp of viability. This is looking at developing a statewide guideline for parents and clinicians providing care at extreme prematurity and pregnancy in non-tertiary centres. So at the moment we acknowledge that there are controversies and inconsistencies, and this is considered a priority for the sector in terms of the advice that we're providing. The proposal has been approved by the governance group of the network. To ensure that we're directing care appropriately, we need to create these guidelines to support consistency of practice and reduce that variation in care. And the recently employed project officer will oversee this work, which will obviously require multiple inputs from various disciplines, as well as a significant component from consumers, and we acknowledge that that's going to be very important in the development of this guideline. In terms of what the guideline will look at, the rough rules are on the screen, but we're really looking around what gestation babies will have care offered, or pregnant women will have care offered for their extremely premature babies, what that counselling might look like, particularly in the more regional and remote centres. How do we reduce the number of high-risk babies born outside of tertiary centres? Looking around the standardising and consistency of antenatal steroid use and magnesium sulphate administration for babies at risk of preterm delivery. The intrapartum management of, particularly if these babies are being born in regional centres, around how do we actually manage these women intrapartum with their extremely preterm babies. And then obviously ensuring that we're providing appropriate advice to families and care providers to assist with the health literacy around this very difficult to navigate space. And we all acknowledge we've been there with women and our colleagues who have had challenging cases. And perhaps I'd like to say the most exciting, but that does not in any way dismiss the projects that I've already presented. Perhaps the most exciting body of work that's going to roll out this year for the network is a partnership between Safer Care Victoria and the Institute for Health Improvement. So I'll just give a little bit of background for those that don't understand the Institute for Health Improvement. So it's a body that is out of the States. It was started in 1991 on the background of work done by Don Berwick in the 1980s. For those of you that were around at the BMJ Quality and Safety Conference last year, you may have had the opportunity to hear him speak. He is inspirational when it comes to quality improvement, and he and some of his colleagues became very committed in the early 90s to improving healthcare by reducing errors, waste, delay and unnecessary costs, all the same philosophies that we at Safer Care share with him. So they started initially in the first 10 years to look at standardising best practice, identifying what best practice is and spreading it to reduce errors that way. And then beyond that, they became very involved in a campaign which you may have heard of called 100,000 Lives and 5 Million Lives, around reducing morbidity through standardising practice and dissemination of guidelines and reducing errors across the states. And those are massive projects that were owned by IHI. It's way too busy to read. It's really just to give the impression of how much IHI has been involved in. They really became involved not just within the States but also globally around spreading quality improvement for healthcare organisations. Probably one of the biggest projects they became involved in was with the Scottish Patient Safety Programme in 2008, and that looked at improving safety and reliability of health and reducing harm in the Scottish healthcare system. So it was the first national health service in the world to take such a big step. And it was initially started to reduce adverse events that occur in hospitals by 50%. And once this was successful, then phase 2 aimed to reduce mortality in hospitals by 15%. The most impressive thing is that that was successful across almost all the trusts that were involved in that in the Scottish NHS, in at least half of the outcome measures that they were aiming for. So it was enormously successful, and is a testimony really to the science that sits within IHI and the quality improvement work that they can achieve. So we are extremely excited to have the opportunity at Safer Care Victoria to partner with IHI. It is the first time that they have done it in Australia, and the opportunities that it presents, not just within Safer Care, but particularly for us as a sector, is enormous. So we as a maternity and newborn network have been, I'd like to say, selected, assigned, to do some work with IHI, and the amount of resource that means that we will then get to do some quality improvement work is significant, and we cannot turn down this opportunity, and we all have to get involved. I'll get to that in a minute. So what we are looking at is to talk IHI speak, we're looking at something called a breakthrough collaborative. That is talk that has been sitting within quality improvement spaces for some time. It is an improvement method that looks about working with what we already know and spreading it to improve healthcare within a system. So we're not looking at research or innovation, we're looking at how do we get best practice out there, how do we improve care. The model was conceptualised in the early 90s around helping healthcare organisations make breakthrough improvements in quality. These are typically short-term projects. We're talking 6 to 18 months with a very, very structured approach to learning and action. So this is what we're trying to achieve, and this is how we're going to do it. So it's the will, the ideas, and the execution. So really what we're trying to do is to get healthcare organisations really involved at ground root level in making real system level changes that will lead to these improvements that we're seeking. There are two key components that come with any breakthrough collaborative. There are subject matter experts, and I'm looking at the room in front of me thinking that's pretty much all of you guys. And then there are improvement experts that can help us drive those quality improvement processes, and certainly that's where IHI come in to give us that expertise. It is data-driven. We've talked a lot about data. We are here because of data. It is data-driven quality improvement, and we're focusing on learning from that. We are ready. Safer Care Victoria, and particularly our network, is well and truly ready for this. We have everything that we've talked about today would indicate that we're ready to take on some big project, and this is it. Really looking at the information that we've got that sits within the current data and driving patient outcomes. And I don't think there's any person in this room that doesn't think that that is an achievable goal for us. So the collaborative that we are embarking on is called the Safer Baby Collaborative. You are the first to hear about this as a sector, so it is very exciting. It is based on the NHS UK campaign of saving babies' lives. So there is some evidence that sits behind this. The goal is to reduce the incidence of stillbirth in Victoria by 20% in a minimum of 10 participating sites by July 2020 and across Victoria by July 2022. So this is an indicator, or this is a marker of mortality for us that has been resistant. And this is our opportunity to do something about it in a way that there is no one here today who does not think that this is a worthwhile goal. In terms of the bundle is loose. This is a loose conception of the bundle. It is yet to go through its working party development, but it certainly includes some of the work that we started in 2018, and that's why that background was important. There could be more components to it than this, and I'm not in any way presenting this as the final draft. But the expert working group that will be configured in March will have clinical leaders, improvement specialists, consumers and evidence-based specialists to contribute to the components of the bundle that will then roll out as an improvement science program. But we're not going to stop there because we're aiming big. So we're also going to do an IHI program. So it's Safer Care Victoria, again partnering with IHI, rolling out a program called Better Births for Mothers. And really this is working on the background that started with the WHA-CEC collaborative of 2017-18 to reduce the incidence of third and fourth degree perineal tears in Victoria by 20% in selected sites by July 2020 and across Victoria by 2022. So the 10 sites that had the opportunity in Victoria to be in the WHA collaborative have seen mixed success, but definitely success. Early results from that collaborative suggest that there's been a decrease of 25% in the number of third and fourth degree tears within 4 months of the commencement of the action phase of the project. So this is absolutely achievable in terms of what we are trying to do across Victoria. So the components of the bundle are yet to be determined again by the working party, but will be loosely based on the WHA-CEC collaborative because that's been shown already by the evidence to have some success. So why am I preaching this to the room in front of me today? Well, this is your opportunity to get involved, and it's an enormously exciting option for you. So this quote that's on the screen is around someone who posted on the IHI website about their experience in being involved in a breakthrough collaborative. So it really is about thinking bigger than your health service and thinking bigger than the patient in front of you around how do we actually make this happen as a sector. And I would encourage you all to get involved as the opportunity presents itself to become involved in such an exciting collaborative, but also to learn the skills that you need to drive quality improvement in other projects, and that's really what you're going to be taking away from this. This is our opportunity to be at the forefront of reducing preventable harm to our patients and learning about that improvement science methodology to really keep moving that forward in other projects that you want to achieve. So how do you get involved? Well, hospitals will be invited to submit an expression of interest for one of the two projects that I've talked about, so the Safer Baby Collaborative and the Better Care for Mothers program. You'll be invited at that stage to become involved in the collaborative with IHI, and then there will be participation in a combination of learning sessions and action phases. So it is structured, it is driven, it is quick, and it is hard work and fun all at the same time. So it is, there will be lots of support for health services to become involved. There is no restriction in terms of the size that you are to put your hands up to want to become involved. So we would invite all hospitals that think that they could learn from this to certainly offer an expression of interest. There you go. Hopefully that's where you're all feeling at right now. I think that's how I'm feeling, so I hope everyone else is feeling that way. I would like to acknowledge again just the contribution of the team at Safer Care Victoria. I feel like I need to give them a little bit of a pep talk, because with the amount of work that I've just suggested we're about to embark on, I feel like I need to give them some positive feedback and say that you're all awesome and it's going to be awesome to do this together. I would also like to acknowledge, though, at this point about the dedicated members of the committees that you've all been hearing from today. So certainly Rod Hunt is the chair of the Insight Committee, but also the governance and e-handbook committees for the amount of work that they put in to our handbooks, and that's both our clinical representatives and our consumer representatives, who both contribute so much of their time to helping improve care for all the patients that sit within our sector.